we had done a really good job as a medical profession in preventing some of the more serious infections, but the children that I struggled with and I tried to understand most were children who came in with concerns of neglect or abuse, and the medical system really didn't know how to respond to those children or to their families. My name is Kris Campbell. I'm a pediatrician and I'm an associate professor at the University of Utah. I'm specifically involved with child abuse pediatrics, and my clinical home is in the Center for Safe and Healthy Families.
So we are working on it's a Child Protective Services and Healthcare Collaborative. So it was really a way to look at how we can improve the communication and the interaction between the child welfare system and our healthcare partners.
We're addressing that through, I think, 3 different projects. One is to look sort of at a national level, take a national pulse to sort of understand whether this is happening in other settings, and whether it is arising out of policies and how policies can either support or serve as barriers to collaboration. The second is to take sort of a natural experience in our own community where a policy was put in place to support collaboration. And then a third is to actually implement a new practice to support that kind of collaboration between physicians and child welfare caseworkers.
We have an administrator at DCFS that we just love what he says about DCFS interventions, which is we want the families to enjoy our services one time. So this is really a chance for us that if we are involved with the family, to get them connected to a resource that hopefully will be with them long term as they raise their children, that that doctor can be seen as a place for them to go to get the support that they need and referrals that they need, and hopefully change the trajectory of the life of these kids.
We are also thinking about how to foster or support a culture of collaboration, either through initiated practices and training for instance, caseworkers, Child Protective Services caseworkers, who can then initiate collaboration with healthcare providers or other agencies that have important information.
Understanding different perspectives and remembering to sit and listen. You know, when my public policy partner tries to explain to me all the different levels of policy and why they would work or not work, and at the same time understanding our community partner, our child welfare partner, explaining why a policy can't simply be implemented because it's one of 100 that were implemented this year.
It is the most diverse set of scholars and practitioners that I've ever gotten to work with. The IRL pool and working with the Robert Wood Johnson Foundation has just been a spectacular introduction to excellent scholars with great diversity, and it's been a wonderful experience.
In a culture of health, I see access to healthy foods and healthy lifestyles and healthcare and just the broad array of that there's not the disparity with the zip codes, that that everyone has an equal opportunity to live healthy and happy lives.
My vision for a culture of health is to support collaborations between individuals and agencies and families to help make sure that we have communities that support children to grow up and develop into meeting their full potential.
We forget that we can make lives better everywhere. I have seen things improve all over the place when we work together, and with a focus on health, we have something in common. We can find the common ground to start collaboration, and so I think focusing on a culture of health for America, for the world, is a way to bring people together to collaborate in a way that can have positive ripple effects.